So let's talk about how to pick a plastic surgeon. Obviously, that is a very personal decision. And what I tell patients is the first thing is you want to make sure some bottom line criteria is met. They're a board certified plastic surgeon, meaning they're trained in plastic surgery specifically, and they've completed their board certification to get that. That means they have some background education and some technical expertise in the procedure you're choosing, right? And then you look at reviews online, you can look at before and after pictures. Those are all very important things to see as well. Then you make a consultation and you have the conversation with the surgeon. And what's important to understand is we're all plastic surgeons, we're all trained in relatively the same way, but the way we talk about things, the way we explain things, even what we suggest for patients may be a little bit different. And it doesn't mean any surgeon's right or wrong or vice versa, it's just difference based on our experiences. So you sit down with them and you make sure you feel comfortable with that surgeon and ask for their expertise in that operation, right? There's a lot of surgeons that do different operations, specifically explant operations. There's a lot of us that focus our practice on doing a lot of those operations. And people that do more of those operations are generally going to have a better understanding of what that operation entails, as well as can talk to you with a little bit more education about it because we just do it a lot more commonly, right? So you want to kind of have that conversation, and then you sit down, you ask your questions, you take some time to get to understand them, not only as a surgeon, but as a person, because it is a very personal decision, and you should feel comfortable with your surgeon, not only if everything went perfect, but feel comfortable that they're going to take care of you if, God forbid, you have a complication, help you all the way through the operation. So I think here at our practice, something that makes us unique is there's a lot of personal care with us. So we spend a lot of time with you. The consultations are an hour to make sure that we answer all the questions you have and we explain things as well as we can for you. We go over before and after pictures to make sure you have a good understanding of what to expect after the operation. And then we're always available. So if you leave the consultation, you have questions you need to ask me about the operation, you call me or shoot me an email. I'll usually call you right back. We'll make sure we answer those questions to make sure it's understandable for you. And then post-operatively, I'm very, very personally involved in your post-operative care. So I'm going to call you pretty much the night of the surgery, the next morning, and then every couple of days to see how the drains are doing. And then I'm going to follow up with you personally. So every time you come in for having a post-op visit, you're going to see me. We're going to kind of go over things, make sure everything looks good. We'll talk about the drains, when they're ready to come out, those type of things. So we're always available. And me personally, I feel like that's how I would want my practice run, right? If I was having my wife have an operation with a surgeon, I'd like to know that they were available and I could ask them questions whenever I need to. And like I said, God forbid, if there was a complication, that they would be there with me to help you through it. So no surgeon can promise you a complication-free surgery, but what we will promise you is we will be here with you every single step of the way to make sure things go on as perfect as we possibly can get.